Hi, I'm Dr. Cooper, and we are going to present for you our December case of the month. Last year it was Bambi, the little Chihuahua that had heart disease, and she's continuing to do well. This month we've selected a dog by the name of Maggie, a 12-year-old Australian Shepherd. And Maggie presented with episodes of tiring out with exercise to the point of almost collapsing. The owners would take her for a walk, and she just could not go. She'd go a block and sit down and catch her breath. And when that happens, we are concerned about several things, whether or not principally it's cardiovascular or whether it is neurologic, because sometimes mild seizure activity can mimic a condition called syncope, which is passing out. So we did a complete workup on Maggie with blood work, urinalysis, x-rays, electrocardiograms, and indicated that there was some early heart disease. We had Dr. Hennick come in and do an echocardiogram on Maggie, and did in fact find that there was some valvular disease and some other issues going on. But Maggie continued after medication not to do the way that we had anticipated, so there were some other symptoms that were going on with her that we felt like that we really needed some answers. And 2 weeks later we sent her to the University of Florida to have an abdominal ultrasound to check for Cushing's disease and kidney issues, and because there were so many things that were going on with her: excessive urination, excessive drinking, passing out. And the University of Florida did another echocardiogram and diagnosed primary pulmonary hypertension. We don't see this very often in dogs, and that's why this case has been pretty interesting, because it takes pretty sophisticated echocardiograms and cardiologists to evaluate the blood pressure in the aorta and the pulmonary arteries. So we ruled out some pretty significant diseases with Cushing's disease and kidney disease and neoplasia or cancer, and they put her on blood pressure medicine. It's called sildenafil. Some of you all will recognize not that name, but the name Viagra, and that's what she's on. Because evidently then when they were doing blood pressure studies in people, they found that there were some other side effects from Viagra or sildenafil that they're using in men. So anyway, Maggie's on Viagra, and she's doing great. She is not probably completely normal, but she can walk for a mile and wants to go more, and she's really doing well. And that was just a really an interesting case, because the owners were concerned that they were going to have to end up putting her to sleep if she did not respond and do better. So Maggie is doing well, and she is not here today, so we're going to probably edit her in sometime probably next week when the owners can bring her down. But I wanted you to meet Maggie, and just because she's just a terrific dog and really a sweetheart. So when you see her again, I'll be in another shirt probably, so it's not like we're trying to do a bait and switch, but I wanted you to see Maggie, so we're going to edit her in at the end of this. I just wanted to give you a brief clinical summary about what was happening in the interest of this case, and once again committed owners that were willing to do what it took to get some definitive answers about what was going on with her. So Maggie, you'll see her in just a few minutes when we get the owner next week or whenever she comes in. So great case, great dog, and a happy ending. So I hope you enjoy meeting Maggie. We'll see you. Now the fun part is I want you to meet Maggie. She is doing well according to her owner. She is not probably as healthy and as happy and as good as she was before this, but certainly much improved. Her pressures are down, her appetite is good, her exercise tolerance is terrific. She still has some issues with heat and with water consumption, but overall is really doing good. Meg, want to smile to the camera? That's great. But she's doing good, and she is a success story. Hopefully we'll give her a really good quality of life for the next several hopefully years. But the good thing is that through a process of diagnostics and through a process of the help of specialty centers, and we were able to give her some real radical changes in what was becoming a pretty serious problem. So we're happy that Maggie's better, and hope that she'll have a very quality, healthy life. Maggie, say goodbye. Bye, folks. Thank you.